All right. Obviously, we talk mental health
Yeah.
issues, things in here, right? But I want, because I am a newer convert to therapy, and I want to share that with our people about what is therapy, all the things. So let's get into that
All
today.
right.
Welcome to It's a Mental Thing, the podcast that dives deep into the power of the mind and the heart of mental health. Whether you're navigating life's challenges, seeking balance, or simply curious about how to care for your mind, you're in the right place. Each week, we explore stories, strategies, and expert insights to help you build resilience, find clarity, and embrace a healthier you. So take a deep breath and let's journey together toward a brighter, more mindful tomorrow. Welcome to It's a Mental Thing, because your mental health matters.
So, as everyone is probably aware at this point, you are a mental health therapist.
I am.
You are a mental health therapist. I am definitely not, but I go to a mental health therapist.
Yes,
and
good.
but Erica, I am a newer, what would you call me? Therapyite?
Well, no, you're a new client into therapy world,
Yes.
like so you're getting used to what therapy is
Mhm.
and getting a better understanding of what we do
Right.
and what we do as the therapist versus what you do as the client.
And I'll be a little I don't know, like I'm just going to be a little real and open about like my situation, but like I have never had any like super traumatic events. I had a absolutely wonderful childhood, amazing family, great things. But I have really struggled, especially in my adult life, with anxiety that can be sometimes debilitating.
Yeah.
And so I got to the point where I thought, it's time to seek out speaking with someone about this.
Yeah.
And so that's kind of how I took that first step into it. But if I'm being honest, like, and you may feel this way too, but I feel like therapy was a drastic thing,
Oh,
right?
yeah.
Like
So for
stepping
you,
into it.
okay, yeah. It's so scary for clients, especially the first couple of times.
And I also maybe thought a little bit like, I mean, I don't think I have a big enough problem to go to therapy. That was my thing.
Yeah.
I was always like, I'm not that bad.
Yeah.
Right?
Yeah.
But then once I experienced it, I'm like, everyone needs to come to therapy.
Absolutely. And it just has, which is why we talk about consistently in the mental health world breaking that stigma.
Yes.
Because not only, just with suicide or self-talk or, being your best self, breaking the stigma of therapy, going to
Yes.
therapy. Back in the day, we were called shrinks. Right?
Mhm.
And so people thought it was very weird for someone to talk to you about your feelings or how you're feeling or place a diagnosis on you or label you with something,
Yeah.
which isn't what therapy is always about. I will never, as a therapist, I don't usually diagnose on the first session.
Mhm.
And that's because I don't know that person enough to slap a label on them or to diagnose them. So some people who are afraid of therapy at first imagine this massive room with this large couch and you're laying there, propped up and you're waiting to that's not what therapy is.
No.
It's just not. Now that you've been there, what's your experience from the first session to now?
It's just like you're just talking with with a friend.
Yeah.
As long as you've got a good rapport with your therapist,
Right.
that's what it felt like to me.
Right.
And what it feels like to me. But it also was just a place where I got so many practical tips
Yes.
for dealing with the things that I was dealing with.
Right.
Right.
And in therapy, like when I was going through my master's program, getting my counseling degree, there are two things that we learned. I remember from the very first class, it's therapists always need a therapist, right? So I too am a client for many different reasons, some from childhood stuff, but also because of the things I hear and deal with all day.
Yes.
So it is so healthy for a therapist to have a therapist. The second was therapists don't give advice. We give positive suggestions. We give, hey, why don't you try this and
Yeah.
see how this works for you in a healthy way? Because if I were to give you advice and say, if I were you, I would do it this way. Okay. Say you go and do it that way. it doesn't work out. Who can you blame?
I'm gonna be like, well, something's wrong with me.
Or you
And
blame
I'm
your
gonna I'm gonna
therapist.
blame
Yeah, your
you, but then I'm
therapist.
gonna also think something's wrong with me, right?
Yeah, and
So
because if it didn't work,
it's just a bad cycle.
absolutely.
Yeah.
So we do not give advice. And for those of you who have never been into therapy, if you think that's all therapists are going to do is give you advice, what we're doing is trying to retrain your brain in the way it thinks.
Yeah.
And give you different suggestions of thinking in a healthy way.
And so what I'm just like now, I feel like I'm this person that's everyone go find a therapist. I'm telling you.
Yeah.
And I've like even told my husband, because he's a firefighter,
Yeah.
and like he is so well adjusted and just like the picture of like calm and preciousness, right? But
Right.
like I even started talking to him and I was like, I think it would be great for you to go see a therapist. Just the things that you see in that line of work as a first responder, like you should go talk to a therapist just to talk it out, because he'll wake up sometimes in dreams and be kind of like, he'll be like, oh, I was dreaming about a call. And I'm like, you need to go to a therapist,
Yes.
just to get it out. It's
Right.
so helpful. So what I thought would be really cool today is for us to, I mean, there's lots of questions that I hear, like what are the top questions that people ask before starting therapy? So we're doing some FAQs. So
Okay.
FAQs, frequently asked questions. So I'm going to be the question reader.
All right.
And you're going to be the question answerer. So basically, let's start from the top.
Okay.
What is therapy just in general?
If we're going, what is therapy and like the true definition of what it is, a lot of times you can hear it referred to as psychotherapy, counseling, therapist. All three mean the same thing, but it's a process where you've got this professional therapist, either a licensed professional therapist, a marriage and family therapist, but they're a professional. They've been to college. They actually have their license. So you want to make sure they have a license in something of mental health and not just a certificate of training of some sort.
Okay, that's good to
Which,
know.
you know, there's life coaches, there's health and wellness coaches. Those are great. They're exactly what they are. They say they're a coach. They're helping you through life. What therapy is an actual professional who's been trained and tested to have a license in that state.
Okay.
So that is what therapy is. And we are trained to help with behavioral, emotional, and relational issues. So again, you said the question earlier, am I good enough or bad enough to be in therapy?
Right.
Everybody has some sort of behavioral, relational, or emotional issue. And when we say issue, that doesn't mean a terrible thing.
Right.
But we all have emotions, we all have behavior, and we all have some sort of relationship. So everybody qualifies for going to therapy.
I think that is such a great word for all of us, that whether you feel like it's bad enough or not, right? Everybody has emotions, relationships, like those things that can be just talked about.
Yeah.
And worked through and straightened out a bit,
Yeah.
right?
Yeah. You don't have to have an agenda to come into therapy, especially if you don't have childhood trauma, if you don't have relational issues in that moment. But the one thing we all have is emotions. And so when you come to therapy, whether you're feeling a certain way or not, or something has happened, you're currently dealing with a stressor or stressors, you have someone who's non-judgmental party, non-biased. I am trained to not put my morals, my values, and my beliefs onto my clients because this is their room, their safe place to talk about whatever emotion they're going through during that season or that stage of life. Because we all do go through those seasons and stages of life that need a little extra support. And therapist can be an accountability partner, can be your support partner, but you do have to find someone where you do have that really good therapist-client rapport, which is pretty much a relationship as a therapeutic relationship and a client relationship together.
So would you say it's okay if, for instance, I come and see you, we don't really, I don't know, there's just something we don't jive that well.
Yes.
Is it okay to seek out someone different?
Absolutely. You want to.
Okay.
So me as your therapist, if there wasn't a good vibe there or if there wasn't a good fit there, as the client, do not feel obligated to stay there if there wasn't a good connection, because what you're looking for is for someone that fits your needs and for someone who is a person you can talk to and connect with. I even tell patients after the first session, if this was a good fit for you, I hope it was. If it wasn't, I'll help you find someone else. I can refer you out, because my benefit of keeping you and not helping you, what is
What's
that
the point?
for?
Yeah.
Yeah. So the benefit of therapy is for the client to receive the connections that they need and the help that they're looking for. And I would be a selfish therapist if I kept them for myself.
Yeah.
And I'm not in this for, the money game or how many clients can I rack up. I'm in this for the helping purposes of my clients.
You briefly touched on, everyone's got emotions, relationships, these different seasons. But this question, how do I know if I need therapy?
Yeah.
I mean, we touched on it briefly, but dig into that a little bit more.
When you get to a point in life that something is off, and only you can feel that. Maybe people around you sense it or see it, but only you get to that point in life of knowing I need to talk to someone and I'm ready to reach out and take that next step. First, I want the patient or the future client to know that is a strength. That is a huge strength to recognize for yourself. And when you know you need therapy, it's because something in your life is causing or it's affecting your day-to-day life, whatever that something is. So I will say, whether it's anxiety, whether it's trauma, depressed feelings, because everybody can be anxious. Everybody can have a depressed day. Everyone doesn't have a traumatic event. But not everyone has an anxiety disorder, a depressive disorder, a mood disorder. But when you feel like something is off and you're ready to take that next step, therapy is needed.
Yeah.
And that is a strength. So when it's affecting your day-to-day life or the relationships around you, that's when it's time for you to take that next step. But remembering that it's a strength to say,
Right.
I'm ready to step out and ask someone else.
Because it is hard. I mean, it's hard. It's
Yeah.
hard to get to that point, especially if you're the type of person that feels like you've always been able to handle it and manage it, and then things become a little bit unmanageable.
Yeah.
Maybe not overly, but a little. And
Right.
you're like, okay, it's time. You're right. That is a strength. So let's talk about then how long. This question is, how long does therapy last? Let's talk about how long does therapy last in the sense of, if I start therapy, am I in therapy for the rest of my life? Is it one session? Is it a couple months? I don't know.
Yeah. So what we do there is we have our first session, which is an intake session where we're really getting to know each other. And I have a form that you fill out before the session. And it's pretty much your history form. You're going to tell me what's bringing you in today. You're going to tell me what's your presenting problem. And then we're going to go down from that list. So that's our first
So
session.
you know what you're working
I know
with.
what's coming in, but usually the client they don't come in with their problem. They come in with what they want to talk about.
Yeah.
Because they want to hide sometimes or run away from what the
Yeah.
true problem is. And then eventually we get to that problem. And that's okay, because being in therapy and mental health is just a journey. It's not a race. It's not about how quickly you can finish therapy.
Okay.
And so what I like to do is I base it on is this an as needed client, which means you've put in yourself an appointment when you need it. You contact me when you need it, once a week, every other week, every 3 weeks, every 4 weeks.
Okay.
So I kind of range it on that, because you have some people who don't have a lot to talk about weekly, right?
Right.
So then you might fall into the let's meet every 3 weeks. Then you've had almost a month of stuff that's happened. And that stuff you bring into therapy. And so if I were to see you every 7 days, maybe nothing's changed
Right.
in your life. And that's okay too. But then I do have people where a lot has changed in 7 days. And we do have to work on some things within every week, every other week. When we have clients that come in forever, for a long time, therapists call them lifers. And so it sounds like you're trapped in therapy for your life, but that's not it. So a lifer is someone who's been in therapy maybe for 5 years, consistently every other week, every 3 weeks, every week, whatever it may be, whatever your treatment plan is. But a lifer is, hey, I'm doing good. It's been 3 months. I haven't seen Erica. That's great. Well, then I start feeling myself going a little bit down, and I'm going to contact Erica again, and then I'm going to get back into therapy. So it may have been 3 months and I haven't seen you, but then you come back, and then we work again, and we get a new treatment plan, and then you go on your way for a little bit, but then 6 months comes by. Then you contact me again. So a lifer is someone who's just in and out of therapy, which isn't wrong either.
Okay.
It's also not wrong to be in therapy for as long as you need. There's no right or wrong.
No right or wrong
Yeah.
answer then, and it just kind of depends on your situation.
Right. And your therapist is going to create a treatment plan with you and let you know. But you, as the client, have the freedom to say, I'd like to come every 3 weeks or every 4 weeks. If they say, I want to come every week, you got to make sure that that treatment plan is based on a weekly basis and that client is in need of weekly treatment.
Right.
Because there is such a thing as too much therapy. Because your brain gets kind of caught into whatever the trauma is or whatever the issue is in that moment. And we want to make sure that we're not overdoing it at certain times.
Because then at that point, I feel like you're not living real life and working through it in real life. You're just
Right.
constantly in a state of treatment help, right? Like there's no, how am I presenting this in my real
Well,
everyday?
and then the therapist becomes almost an enabler.
Yeah.
You know?
I could see that. Okay. Okay. So progress,
Yeah.
because I mean, that's going to affect too, like how long we're in it. How is it even measured? Like, how can you measure progress? I mean, am I crying in therapy or not?
So it's measured by the mood and if there's changes in the mood in a positive way. We're always looking for positive change.
Yeah.
So positive mood changes, positive behavioral changes, positive relationships in their life, and their overall well-being as an individual. We're looking at positive changes as far as progress goes. Achievement in specific goals that we have set.
Okay,
So
yeah.
a lot of patients that I have, I will do, there's reality therapy where we're trying to like speak realistic things that are happening in their lives. And then there's also something else I will work on with patients, where it is called, where I'm exposing them to their worst fears. So exposure therapy. So if, for example, if I've had a client who's afraid to drive after they've had an accident, right? So that's very real. It's a very true fear. And then I have them make a goal of, hey, within the next week, I want you to sit in the passenger seat of someone's car. And then if they've done that, check. We've made one progress and a goal.
Yeah.
Then the next week, hey, I want you to take 2 travel trips in the passenger seat. Then the next week, I want you to try to get in the driver's seat and try to just turn the car on, reverse out of your driveway. So we're slowly, like I said, it's that journey. And when we're making positive changes in our goals and we're moving upward instead of going backwards, that's progress in any of those areas of life.
And having someone to hold you accountable as you're setting goals and pushing forward, like that is huge just in itself, is having that accountability. You
And
know?
no judgment.
And no
You know,
judgment.
if that person couldn't get in the passenger seat that week, I'm
It's
not
okay.
mad at them.
Yeah, it's okay.
I'm proud of them for even thinking about it and considering it.
Yeah.
But if they couldn't do it, they're not ready.
Right.
And when you're ready to get there, that's when the progress starts happening.
I like it. Okay. So I love the concept of the accountability with goal setting. Like that is huge in so many different areas of life, but especially therapy. Okay. So let's talk about now. These are some questions about finding a therapist. How do we know what's the right fit? What do you ask? So from a patient perspective, I am calling and I'm saying, okay, I've gotten to the point now. We realize that we need therapy. Who are we calling?
Yeah.
Like where are we? What's the first steps that we're taking, and what do we need to ask them as far as like, I don't know. I don't even know what to ask you to ask them.
Especially if you've never been.
Yeah.
If you've never been a client before. therapists, mental health providers, we tend to have a lot of letters behind our names. And when you're Googling
Yeah.
a therapist, right, or a therapist near me, I will say Psychology Today is where you can find really anybody who actually has a licensed state number.
Oh,
So
Psychology Today?
it's a
Okay.
website. You can put in your zip code. It's going to bring up tons of people within a 30-mile radius of where you are. So Psychology Today is a really good reference, and you need to use that if you're looking for it.
Okay.
Because if you just Google, you may, John Smith may pop up, and he may be just a certified helper.
Right.
Right?
Or like
So you want to
life
know what you're
coach,
looking
something
for.
like that. Yeah.
And so for me, I'm an LPC, I'm an NBCC, I'm a CBDT. I mean, all the letters, right?
That was like 13 letters.
Yeah, so
Okay.
it's like Erica Wilson and then letters. So
Okay.
we call it the alphabet behind our name.
Yeah.
And it's just to show you what I've been trained in,
Mhm.
what my expertise is in, and then what kind of ethical test and state law I'm actually following based on my license.
Okay.
So you want to be sure what you're looking for, what you know. Even if you do have to Google, what does LPC mean
Right.
in mental health therapy? So LPC is just a licensed professional counselor. And then the NBCC, National Board Certified Counselor, Certified Board Trauma Specialist. So you're wanting to make sure whatever you're looking for, you find someone who is in that niche, okay? Because if you aren't a married person and you find an LMFT, which is a licensed marriage and family therapist, they still are very beneficial. But say you're a single 18-year-old, you may not need a LMFT. Right? So you want to know who you're looking for. Then you find this list of people that match what you're looking for, and then you go through and you read their descriptions, okay? Everybody should have a pretty decent website about me. So you want to read about that therapist. You want to read their specialties, and you want to read their skills. Because if they're not an expert in something that you are struggling with, and I'm a mental health therapist that does a wide range of therapy, right? But there are certain things, I'm not going to pretend I'm an addiction specialist, right? Or I'm not going to pretend I am an expert in like eating disorders or something like that. Can I work with those people? Absolutely. Will I probably refer to a therapist that just does that as a specialty? 100%. Because you want to make sure you're working with someone as the client that gets you and understands whatever you're struggling with or whatever your diagnoses may be.
Right.
So as far as finding the right person, you want to look up Psychology Today, put in your zip code. You may even look, they're going to point in your direction what skill sets they have. And then you want to read about them. You can sometimes get a vibe just by looking at their picture, just by looking at their bio, just by looking at their website.
Yeah.
Then you want to call. And the first session, again, doesn't mean you're stuck with them. I don't want anybody to think they have to pick the first one and like the first one. If you do, that's wonderful. If you don't, it's also okay to find someone else.
Yeah. I think that's really good advice too. Another thing that these are very good questions, by the way, but another thing that I think people might be concerned about too is cost.
Yeah.
Because I mean, obviously, if we're thinking about health, right? If you like a heart problem, obviously, like that's a life or death situation. You have to get that fixed, right? I think people may think of therapy as like, maybe it's just an option.
Right.
Even though, hey, this could be a life or death thing as well, right?
know.
And
Yeah.
and that's the scary part about it. But it needs to be priority just as much as everything else does. So talk to me about does insurance cover it? Like, is it what does that look like?
Every therapist is different. I accept all insurances, and then I also will do a sliding scale fee. And
Okay.
so a lot of people who have been in therapy or who have done any kind of health work, whether it's medical or whatever, knows some people do a sliding scale fee. But if a therapist accepts insurances, you want to call the number on the back of your card and see if that therapist falls into their portal,
Okay.
or if they're a provider for that therapist, and then see what their eligibility and benefits are. If they're covered with mental health, that's great, and that therapist is going to accept their insurance. if they don't cover your insurance or if they are a patient pay therapist, that means they're not going to take any insurance and they're going to charge you the full fee. Now, you can always ask for a sliding scale. And for me, I will say, hey, what is it that you can afford for this session?
Right.
Because again, I'm not in it to cause more stress. I'm in it to help the person, but it's also my full-time job, obviously. But I am going to do what I can to help that patient. So a sliding scale usually ranges from about like $70 a session. Usually it's doable for most people. And if it isn't, we work with that patient and see what they can do. But most therapists will take insurance. If they do not, you want to see if they have a sliding scale fee. If they are a patient pay only, they're going to ask for the full amount for their session.
Okay.
Yeah.
Well, I think we have covered a lot. And for someone just sitting here listening, thinking, okay, maybe it's time for therapy. Maybe it's time for me to look into it. I feel like we've covered a lot of the how, the why, what does it look like? And I guess what we really want everyone to know is this is not a huge, scary, drastic step that you're taking. This is a wonderful, like affirming, encouraging, like life-changing, but in a good way step for them to take. And we, Nicole and Erica, we want to encourage you to take that step for sure, because it's just so beneficial in so many ways.
It is. And just don't feel shame, don't feel guilt, don't feel all the things that you're hearing, the background noise of what therapy is or what that may mean for you if you have to go. It means nothing. It means you're actually stronger than you think you are, and you're looking and actually asking for help.
Yeah. And it means you're going to sound so much smarter when people come to you with problems now.
And you're going to feel that weight of the world lifted.
You're going to feel stronger, everything.
That's great.
Thanks.
Be sure to follow our podcast on your favorite platform or find us on YouTube. Just a quick note. If you're facing a mental health challenge, we encourage you to seek help from a licensed therapist like Erica or a healthcare provider. Remember, your well-being is personal, and only a professional can provide guidance tailored to your unique needs.